Hey, my name is Nichelle Mullins, and I am the President and CEO of Charter Oak Health Center. I am pleased to be joined this morning by United States Senators Richard Blumenthal and Chris Murphy, along with the Commissioner of the Department of Public Health for the state of Connecticut, Commissioner Coleman Mitchell. This morning, we are here to highlight the importance of flu shots, as well as our open enrollment period, which ends on December 15th. Charter Oak is a federally qualified health center. We serve patients regardless of their ability to pay. We are open 7 days a week and available to administer flu vaccinations. Please come down, get your flu shot. It's very important, especially this season. In addition to that, we have case managers on site who are available to assist with open enrollment. And without further ado, I'll turn it over to Senator Blumenthal.
Thank you. Thank you so much. Thanks a lot. Thank you so much for having us today. I'm always proud to be at this great health center, which serves so many people so well. And thanks to my colleague, Senator Murphy, and the Commissioner for being here today, and all of your staff. There were, yesterday, announced 2 deaths. 2 deaths from the flu is too many, but it's only the beginning. There have been already 47 hospitalizations. Last year there were 88 deaths, and this year promises to be another severe season. But make no mistake, if you get the flu, it's a severe flu season. And flu is preventable, needless for you to suffer through it, missing work, potentially infecting family and others. So if you get the shot, you will avoid the flu. It's really pretty simple. It takes a few minutes, and it is costless if you have insurance. There is no excuse for anyone to avoid getting a flu shot. And if you get the flu, it will be the most severe season ever for you, regardless of the overall statistics. And that is why we are here today to urge everyone to come to clinics, pharmacies, wherever flu shots are offered, and they are offered all around the state, and they are free as long as you have insurance. Now, the administration is doing everything possible to sabotage and destroy our health insurance system, the Affordable Care Act. Right now in the courts, it is seeking to undercut and eviscerate it. It's undermining advertising during the current open enrollment season. It is taking other steps that would sabotage the ACA. In Connecticut, we are better protected, for example, in cutbacks on protection for people suffering from pre-existing conditions, but still, we will feel the effects. The effects may be devastating to Connecticut if the administration succeeds in its effort to repeal and destroy the ACA. So we're calling on the administration to stop these efforts. We're suggesting to people you should get a flu shot because it is covered by insurance. It can avoid needless cost, pain, suffering, loss of work. And I am also hopeful that this Congress will again appropriate money for research to do a universal flu vaccine. A bill that I am advocating, it's called the Flu Vaccine Act, would provide $1 billion over 10 years for research into a universal flu vaccine shot that would cover all strains and kinds of flu. As you know, every year the flu vaccine has to be, in effect, reinvented based on predictions about what the specific types of flu will be rampant that year. And this kind of research would help develop a vaccine that is applicable to all strains of the flu. I'm hopeful that we will pass, again, legislation appropriations as we did in 2018, $100 million. In 2019, $140 million. Next year, I hope we will pass another $100 million. But the $1 billion over 10 years, if it's authorized, would provide a steady stream of funding. With that, let me turn it over to Senator Murphy.
Great. Thank you very much, Senator Blumenthal. Thank you to our friends at Charter Oak for having us here today. It's wonderful to be back at a health center that is serving so many families here in Hartford and in the surrounding areas. Amongst our to-do list for the final few months of the legislative session is to extend the funding for health centers all across the country that allow for these doors to be kept open. The lion's share of funding that keeps community health centers in business is federal dollars. Those federal dollars expire in November, and if we don't pass that legislation, then there are going to be consumers here who aren't going to be able to get access to care for the flu or for whatever medical emergency they are coming here to get service for. Senator Blumenthal is right. 2 deaths are too many. We've already had about 100 people in Connecticut who have been hospitalized for flu symptoms. We expect, once again, this will be a difficult flu season. There are 2 things you can do to protect yourself from the flu. You can get the shot, and you can make sure you have health insurance. That shot is most important right now, but if you end up coming down with a version of influenza, then you need to be able to get health care. And the only way to get health care without it bankrupting you is to have insurance. Open enrollment closes down December 15th. And if you don't have insurance through the exchange by December 15th, then even if you get diagnosed with the flu, you can't go and sign up after December 15th. So it's imperative that people go to Access Health CT and shop online for a plan before December 15th that will provide them health insurance for the season. Getting the shot is important, but getting insurance and making sure that you and your family are covered before the middle of December is incredibly important as well. Plans are affordable. In Connecticut, the majority of people who go onto the website qualify for subsidies. And the average subsidy in Connecticut is about $500 per month. So people can find affordable health care, by and large, if they're going to shop for health care on the Connecticut Exchange. The premium increases have been small this year. So you're not going to see a big jump in this year's premiums from last year's premiums on the exchange. That's a real benefit to Connecticut consumers as well. But as Senator Blumenthal mentioned, the Trump administration for the last 2.5 years has been engaged in an effort to destroy the Affordable Care Act. Many people in Connecticut don't think that the Affordable Care Act still provides them options for insurance that's affordable because of the attacks that Donald Trump has launched. And he has launched devastating attacks. He's pulled money for marketing. He's pulled money for navigators. He's shut down payments to insurance companies. He's launched a lawsuit in court to try to overturn the entirety of the act. But the Affordable Care Act survives. It's still there. Despite the way that the president talks about Obamacare on TV, if you go to Access Health CT today, you will find health care available to you and health care that for most people is very, very affordable. So those are our 2 messages here today. Obviously, our job is to fight hard against the president's sabotage campaign in Washington. Our job is to stick up for our great health centers to make sure that they have the funding that they need. But your job as citizens of Connecticut, as parents, as grandparents, is to make sure that your family gets a flu shot by as soon as possible, and to make sure that your family has health insurance. We're really glad to be joined here today by somebody who knows a lot about the provision of health care and health insurance, and that is our great Commissioner of the Department of Public Health, Commissioner Coleman Mitchell.
Thank you. Well, good morning, everyone. As your Commissioner of the Department of Public Health, this message is for every Connecticut resident. Get your flu shots. I did have something to say in terms of statistics, and the data, but our illustrious senators took that from me. And so I think, if more than anything, is to really set the example. And the example that I want to set is that I am getting my flu shot as the commissioner of the Department of Public Health today at a federally qualified health center, Charter Oak. My words are going right into action, and that's really all that I have to say. For our Connecticut residents, get your flu shot. It's imperative. Thank you.
We're going to do it side by side.
Yes, we are. Yes, we are. Hopefully I don't break down and cry.
We'd be happy to take take questions.
I had a question, and that is, a lot of people want more information. You know, when we hear about the flu deaths, people, we don't know, did they get a flu shot? What strain of the flu? So those are all things that I think people are concerned about when they hear about these deaths. So is there any way to have more transparency when it comes to that kind of information?
I can only add to the fact that we have to always protect individuals' confidentiality in terms of health care. We do have our subject matter expert here if you have more particular questions that we can bring up. Matt? Okay. Nick, you want to address that as well?
So we are only allowed to release, Mick Bolduc from the State Immunization Program, we're only allowed to release certain information. So the only information we can release at this time is that they were residents of Fairfield County and Litchfield County, and they were 65 years of age and older.
Right, no, I understand, and under HIPAA, I'm sure that it would be beneficial, don't you think, in some way, because people want to know if they've had a flu shot, maybe they would. Okay.
That's the only information we can release at this time.
Well, correct me if I'm wrong. The flu shot is standard. It's not like you shop around for different kinds of flu shots, right? In other words, the flu shot we're going to get here is the same as everywhere in the country.
Right, I think what she's asking is if whether or not they were immunized or not. Whether the public would like to know whether or not they were immunized.
Well, I'll give you the layman's version, which is no vaccine, no preventive action is foolproof, and the numbers are very high, whether it's 85% or 90% effective rate. The point is, the flu can be deadly. For people who are seniors, for children, they are most vulnerable. So if you fail to get a flu shot, you are potentially taking your life in your hands, especially if you're older or younger. And whether these individuals got a flu shot or not, I think the basic lesson here is you substantially protect yourself and lessen your chance of getting the flu if you get a shot.
Can I just ask a question about affordability of Access Health plans this year? They went up on average 3.65%, but the part of the reason why they went up is because of the federal health premium tax was assessed this year, and it hasn't been assessed in past years. Are you doing anything to eliminate that or work with that? I mean, I know the president hasn't put forward any sort of plan yet as far as his proposal. Are Democrats working on their own?
Well, listen, a 3% increase is a pretty reasonable increase, right? And so, I don't know that we should expect that we're going to do a lot better than 2 or 3% premium increases in the exchange. Dick and I have not talked about our positions on the health insurance premium tax, but there's a suite of revenue generators in the Affordable Care Act that pay for the subsidies that provide health insurance for people that are in need. And so there are all sorts of people that want to wipe out all of the taxes in the Affordable Care Act. But if you do that, you will ultimately lose all the revenue that pays for the subsidies. So the idea was to spread out revenue collection over all insurers, all drug companies, all medical device companies, and use that revenue to help people in need that had lower incomes that couldn't get insurance without the subsidies. So I will just say I have been skeptical of gutting the revenue in the Affordable Care Act. Nobody likes to pay a single tax, but you need to be able to come up with the money to help people buy insurance. And I, frankly think across the country we've been, seeing some very small increases and some decreases in premiums in the exchanges.
Here's what I view as the most important fact today in American healthcare. The costs are rising astronomically. the most important goal we should have in healthcare insurance and healthcare generally is to bring down the costs, or at least prevent the astronomically rising costs of healthcare, particularly pharmaceutical drug prices. And there are various proposals. Senator Murphy and I are supporting them to bring down the costs of healthcare, but 3% looks good only because the past increases have been so high. And as you know, I have fought those increases. As Attorney General, I went to hearings that resulted in reducing some of those increases. 3% or 3.6% looks good because the past increases have been so high, and there is no free lunch. If the costs of health care continue to rise, costs to consumers and to insurers will continue to rise as well. So the dynamic here, what's driving these increases, is the cost of health care, and we need to do more to bring it down.
Well, in other states, not Connecticut, the costs have gone down on average 5%, like in North Carolina, but in Connecticut, on Access Health, they continue to increase.
Yeah, I mean, listen, every state has different dynamics, and different companies have different sort of internal decision-making processes when it comes to rate increases. Listen, we have a problem in Connecticut, and then we only have 2 insurers that are offering in the exchange. You know, part of the reason why Dick and I both support adding a Medicare product to every single exchange is because one of the things that will drive prices down is having more competition. States that have more competition, unsurprisingly, have more pressure on insurers to lower costs. And with only 2, listen, I'm very glad that we have 2 insurers offering in Connecticut, and I'm grateful to them for continuing to offer products in the exchange. But we want to see more competition, and that's part of the reason why, you know, we're hopeful that after this presidential election, we'll get to have a conversation about putting a Medicare product on the Connecticut exchange. That will immediately provide a low-cost option for consumers here, and will put pressure on others to drive costs down.
So do you prefer the Medicare proposals, some being floated by the presidential candidates, or would you be okay with a public option?
So I have my own piece of legislation that is a universal Medicare buy-in that would allow for individuals on and off the exchanges to be able to buy Medicare, but also to allow businesses to buy Medicare. So I would like to see a robust Medicare product be available to every single American and every single business, so not just on the exchanges. In the past, we've talked about just putting on the exchanges. I'd like to see the Medicare program opened up to everybody.
And I've supported similar proposals. I've also supported a single-payer system that would, in effect, be Medicare for all in some form. And I think ultimately we're going to have consensus, assuming a good outcome in the next presidential election, that we will move forward with health care reform to provide that option for everyone.
I have an off-topic question if no one else has anything on this.
I just have one really good question. I know we've discussed this before, but the most common excuse we hear from people who don't get flu shots is that in years past they've gotten it and they've gotten sick. Can someone address that?
In years past, they've gotten sick even after.
From the flu shot.
So, I am so glad you asked that question, and I mean that because
That's Susan's question, right?
and that's been an issue for me. I stand here today, and this is the honest truth. I remember getting a flu shot years ago, and I got deathly ill, and I had the signs and symptoms, everything that the flu would give you, everything. That was years and years ago, and I remember vividly thinking, wow, this happened hours after I got the flu shot. I have talked to many physicians. I've talked to many people who have experienced similar reactions, and it still remains the fact that the best thing that we can do in terms of public health is still get the vaccine. There's about the 40% issue of being able to prevent it is the key in terms of public health. People have said it's been coincidences. People have said that that just happened to be at the same time that I got the shot that I was going to be getting the symptoms and having that. that still remains out there, and we need to debunk that, right? We need to talk about public health in its essence of getting shots and preventing illness. There are people here in this lobby that I've had conversations with right before this press conference who have said that they are not interested in doing it. I understand that. But as a commissioner for public health in the state of Connecticut, it is imperative that we always try to protect the public's health. And so I'm always going to be down that road of saying that prevention is the best key, and to have a vaccine is the key to doing that. And so I wanted to say, as a person who went through that, right, as the commissioner, I wanted to be really proactive and literally say, people need to see me get the vaccine today.
And the vaccine takes how long to be effective? 3 weeks?
Usually 7 to 10 days.
7 to 10 days, okay.
Right.
But
See?
let's be clear. The flu vaccine does not make you sick.
That's right.
There's no evidence that the flu vaccine makes you sick. That is a myth. If you're sick after getting the flu vaccine, it is not because you got the flu vaccine. So that is just, that's not true.
Or to put it a different way, there is only upside in getting the flu vaccine. It may not be foolproof, it may not be 100% effective, but it certainly doesn't cause the flu or any other kinds of diseases, and it takes a while to be effective. So that's why we're urging people to do it now rather than waiting until the height of the flu season.
On the community health center funding, do you expect that will get approved, or is that in doubt?
Listen, I sit on the health committee. We have the legislation that would keep the health center funding flowing. I hate to say it, but it's a fight. We have a lot of Republican colleagues that don't want to reauthorize funding for community health centers. We have a president that does not want to put money into community health centers, and so this is unfortunately a fight right now. Democrats are very strongly in favor of funding community health centers and making sure that these doors remain open to the hundreds of thousands of patients who come through it. But we are having trouble convincing our Republican colleagues. I think we will get there. I think that we will eventually get to a compromise in which we get the funding flowing to health centers, but this is not, unfortunately, a consensus issue in Washington.
You know, as you remember, every year it's been kind of perils of Pauline, reaching the precipice, almost over it, and then at the very last moment the funding comes through, mainly because, as you see here, thousands of people in Connecticut. In some cities, the majority of people depend on federally financed health centers like this one. And that's true across the country. So at the point where funding is about to end, our Republican colleagues kind of get religion and go along with it, but it takes a real fight. And so I would predict we'll have another nail-biting, precipice-nearing fight where we come close to the end, but then it's funded.
And when does the funding expire?
I can tell you for Charter Oak Health Center, our funding expires December 31st. So that means, as the CEO, I have to start looking at how many staff I might have to lay off around the holidays, unfortunately.
And how big of a factor is that for your finances?
It's a huge factor because if I am looking at potentially laying off between 40 to 50 people, I have to think about how many patients that will impact, because there's still the need for the community, and we won't be able to meet that need anymore.
Do we know the effectiveness of the flu shot this year? How effective is it? I mean, each year it seems like it fluctuates.
So we won't know the effectiveness of the flu shot until probably January. CDC does studies on that, and we usually don't know that until January.
Historically,
it goes year to year. So last year was not a very good match. It was about 29% effectiveness. So when CDC has that data, we'll certainly share that with everyone, but usually that information isn't available until January.
Is it always a new strain each year?
Typically, they change at least one strain every year. It depends on what the World Health Organization comes out with. They look at what typically goes on in the southern hemisphere and what they predict comes out in the northern hemisphere.
Which is the purpose of the research that we're funding, so that we have a universal flu vaccine that will apply to all potential strains, and they won't have to develop a new one every year with possible shortages. At the beginning of this flu season, there was the specter of possible shortages.
Are there any conclusions that you can draw from the number of cases that you've had so far, or most of them being type A?
It's just too early to tell right now. It's still way early in the flu season. But, when we talk about the vaccine and the vaccine effectiveness, it's still the vaccine, even though it's not a perfect vaccine like the Senator had mentioned, it's still the best tool that we have. And so that's, when we talk about 20% effectiveness or 30 or 40% effectiveness, that's still better than no effectiveness at all. And it is going to give us some protection, and it will prevent severe illness, and it will prevent hospitalizations, and it will keep you alive.
And is this sort of the typical start to the flu season, either in terms of when it's happening or in terms of...
It's pretty much mirroring what we've seen in the past so far.
Great.
Yeah, on the topic, Senators, just wanted to get your reaction to yesterday's tragedy in Southern California, and I understand you were on the Senate floor making remarks prior to that. If you could share that as well.
Well, we were on the floor together. We went to the floor seeking unanimous consent to move forward with the bill that's already passed the House for universal background checks. And I spoke about that bill and about emergency risk protection order, citing Connecticut's experience with both. As I was speaking, I was passed a note saying shooting in school, Santa Clarita, California. And for a moment it took my breath away, because I flashed back to Sandy Hook and Newtown, most prominently, and other mass shootings that we've seen on schools. This one is the 7th just this year on campuses. As I said on the floor of the Senate, it goes beyond a political responsibility or a legal mandate. It's a moral imperative that we stop these shootings, and the Senate of the United States, our Republican colleagues, are going to be complicit in these shootings if they fail to act. I've continued in conversations with the White House, even after impeachment. At a staff level, my colleague, Senator Graham of South Carolina, and I have a proposal. It is just about complete on emergency risk protection orders. We're trying to couple it with a proposal that Senator Murphy has helped to lead on universal background checks. This sensible, comprehensive program is perfectly doable. More than doable, it is absolutely necessary. And the good news is we are winning this fight at the grassroots level through all of the groups that have mobilized and become a movement that has political weight even beyond its numbers, and it will be an issue in the next election. History will haunt our Republican colleagues if they fail to act, but even more immediately, voters will haunt them in the results of these elections. And that's the point, among others, that we were making on the floor of the Senate. But I will tell you, as I stood there speaking for a moment, took my breath away just to think of another shooting on a campus, loved ones searching for their children, panic, uncertainty, grief, heartbreak. And we have been through it so many times, we have to prevent ourselves from regarding it as the new normal.
What we were asking for yesterday was a vote on a universal background checks bill that is supported by 90% of the American public. And Republicans objected to our request because they said they wanted input into the proposal. Well, they've had years to have input into this proposal. Republicans run the United States Senate. At any time, they could choose to bring this proposal or a proposal of their own making before the Senate to try to save lives, and they haven't done it. We haven't spent a minute of time debating legislation to reduce gun violence in this Republican-controlled Senate, and that's an abomination. I will just say this as well. Last night, I was at a gathering of Hartford parents, Mothers United Against Gun Violence, and they remind me that while these school shootings rightfully get media coverage, there's shootings going on every single night in neighborhoods not far from here or down the street from Yale, New Haven, or around the corner from St. Vincent's. There's 100 people every day that die from guns, and most of them don't make the national headlines. And so, our heart goes out to Santa Clarita. It does. We need to remind people that this is a daily epidemic that largely happens to young African Americans and to poor people. And those shootings don't get the headlines, but they deserve just as much attention.
And, Connecticut's experience is really important. And both Senator Murphy and I have talked about Connecticut's laws. They work. They bring down the rates of homicide and suicide and other shootings on our streets every day, 100 every day in this country. A lot of them, people taking their own lives. And these two proposals keep guns out of the hands of dangerous people. They prevent dangerous people from buying them and from keeping them. And Connecticut's experience shows they work, but even with the strongest gun violence prevention laws in the country, we're still at the mercy of states with the weakest, because guns, guess what, have no respect for state boundaries. They cross those boundaries, they find their ways into the hands of criminals and punks and gang members and people who suffer from mental illness. So, we have continued this fight, and we will continue this fight.
Great. All right. Thank you very much, everyone.
One more off-topic question. Both of your thoughts on the impeachment hearing so far?
Well, I thought the testimony from George Kent and Bill Taylor was absolutely devastating. Further confirmation that the president was at the center of this extortion campaign. You just are not allowed, as the President of the United States, to use the power of that office and taxpayer dollars to try to pressure a foreign government to destroy your political opponents. The difference between a democracy and a tin pot dictatorship is that in a democracy, you're not allowed to try to convince foreign nations with taxpayer dollars as leverage to help you politically. And so I thought the testimony was absolutely devastating. I was glad that the country got to see these two patriots. I got to know Bill Taylor during my trip to Ukraine in early September. I was able to talk to him about Rudy Giuliani's subversion of American foreign policy. He was concerned about it when I met with him in Ukraine, and I'm glad that he has now chosen to tell the truth about what happened. Obviously, we will wait for this process to play out. The House will have a debate over articles of impeachment, and if they pass those articles, they will come to the Senate for a trial. But I've been pretty clear. I think the behavior that the president has engaged in and that over a dozen administration officials and witnesses have testified to is impeachable. I would have to wait to see the exact articles of impeachment before I decided my vote, but I think this is absolutely devastating testimony. You'll hear more of it today and next week, and hopefully over time our Republican colleagues will realize that they are Americans first and Republicans second. They swore an allegiance through their oath of office to the Constitution, not to President Trump. And I hope that they figure that out very shortly.
Well, I'm going to speak like a prosecutor or a former state attorney general. The key word here is bribery. Bribery. Offering a service in return for a thing of value. The President of the United States used our taxpayer dollars, military assistance to Ukraine, which was fighting for its life, a partner of ours. in return for a personal benefit, a thing of value to him. That's bribery. And the most damning and devastating evidence is the president's own words. We should never lose sight of that July 25th conversation. There's a transcript of it, an official one, where, in effect, he commits the crime of bribery. And all of this very powerful testimony from career, non-politician civil servants who, by the way, have everything to lose and nothing to gain by being there, is simply to confirm and corroborate the president's own words. And it's part of a pattern. All around the world, it's his MO, offering and using official power for personal gain. And that's what he did in that instance. Bribery is one of two crimes mentioned in the United States Constitution as impeachable. The other is treason. Bribery is specifically set forth in the Constitution as a reason for impeachment. So the Republicans are going to argue, well, it may be wrong, but it's not impeachable. On the contrary, the founders meant for bribery to be impeachable, and we're going to be jurors. I will listen to anything the president has to say on his own behalf that's exculpatory, but so far we've heard nothing from him that in any way alleviates the responsibility and accountability that ought to be imposed here. And we're going to continue to hear more witnesses. These witnesses have been so damning because they are all about the facts. In a world that is politicized beyond belief, these witnesses are talking facts. And they're doing it in a very non-political way.
All right. Thank you, everyone. Thank you. Thank you.